Hi, it's Dr. Claudia Kim again, cosmetic surgeon here at New Look New Life. Today, we're going to talk about one of the most popular treatments in aesthetic medicine, neuromodulators or neurotoxins, or more commonly known by Botox. What people don't realize is that Botox is just one of the brand names of the neuromodulators, just like Kleenex or Band-Aid. Botox, Dysport, Xeomin, Jeuveau, and Daxxify, and the newest player in the game, Letbo. These are all neuromodulators, but they all contain the same active ingredient to temporarily relax muscle activity to soften the lines of the face and wrinkles. But here's something most people don't know. So Botox wasn't actually created for cosmetic use, and it actually has a fascinating medical history. Botox was first used in the late 1970s by an ophthalmologist, an eye doctor, to treat patients with uncontrolled eye spasms. And then doctors noticed something unexpected. The skin around the treated area actually became smoother, or the crow's feet. So by 2002, the FDA approved Botox for cosmetic use, and it actually completely changed the aesthetic industry. And today it's one of the most studied medications in the world, with over 700 studies, publications showing its safety and effectiveness. So how does it actually work? When we make these facial expressions like frowning or squinting or raising our brows, the underlying muscles contract and fold the skin. And over time, these folds become lines that don't go away even when you're at rest. And neuromodulators act at the neuromuscular junction, which block the signal that tells the muscle to contract. So the result is relaxed muscles, softer lines, and a more refreshed expression. So what areas can we treat with neuromodulators? So commonly the forehead lines, the 11s between the eyebrows, again, the crow's feet, the bunny lines on the nose, gummy smile when the gums show when you're smiling, lip lift for everting the upper lip to make it appear fuller without adding volume with fillers, or smoothing out the smoker's lines on the upper lip, DAO for the downturned mouth corners or frowning, chin dimpling that you see right there with like the little indentations, masseter muscles for slimming the jawline, or if you're a teeth grinder or if you have TMJ tension, neck bands that go up and down the neck, or it pulls the lower jawline skin called the Nefertiti lift, Traptox or Barbie-tox for slimming the neckline, witch nose when the nose points down when you're smiling, or even in the calves, the legs, to make the legs appear thinner. And beyond aesthetics, neuromodulators can actually help with migraines, sweating or hyperhidrosis, and muscle spasms. So results can take about 3 days or up to 2 weeks to appear, and typically last about 2.5 months to 6 months, depending on the specific brand. Now let's talk about safety and possible complications. So Botox or neuromodulators are extremely safe when they're done by an experienced injector. But like any medical procedure, there are risks that are associated with it. So some of these temporary mild side effects include redness or the tiny bumps at the injection site, mild swelling or bruising, or headache, or a heavy feeling in the forehead if that's the area that you treated. But most of these typically resolve on their own. Less commonly, but it still can happen, is eyelid or brow ptosis, and it's a temporary drooping of the eyelid if the product migrates, or smile asymmetry when you're treating the masseters or the mouth areas like a lip flip or the DAOs. Other issues with the lip flip include like difficulty drinking from a straw, or spitting when you're brushing your teeth, or let's say difficulty fully raising your brows if too much is placed in the forehead, or neck weakness if it's injected too low during a neck treatment. So these are temporary and can be minimized with precise dosing and proper anatomy knowledge. So my philosophy is natural, elegant movement. So you should still look like you, just better rested, refreshed, and confident. So if you're considering Botox or trying neuromodulators, or you simply want to learn what's right for you, schedule a consultation. I'll evaluate your anatomy, your goals, and we can create a plan that fits your lifestyle. Thanks for watching, and give me a like and follow for more videos. Thanks.